The opioid crisis has brought to light the devastating effects opioids are having on individuals, families, and communities across Canada. Young Canadians aged 15 to 24 are the fastest growing population requiring hospital care from opioid overdoses. In Canada, 12 lives are lost daily as a result of opioid overdose. 94% of opioid overdose deaths happen by accident. The opioid crisis continues to grow. At South Cochrane Addictions Services, we recognize the impacts the opioid crisis is having on individuals, families, and our community. We also recognize the importance in having conversations around problematic opioid use. Research shows talking about risks, discussing prevention strategies, and informing individuals how they can identify problematic use are key prevention tools in reducing harm. These conversations also help dispel myths and combat stigma. As stigma leads to hiding, creates barriers to help seeking, and results in poor quality of care and response, we encourage everyone to take part in these conversations. Not only do we want to keep the conversation going, but also demonstrate we are committed to doing the work. We as an agency continue to work hard to provide quality, evidence-based services in response to the opioid crisis. We continually strive to improve and adapt our services to reduce barriers and better serve individuals accessing our services. We continue to work to address this crisis by adapting services to provide continued support throughout the COVID-19 pandemic, offering in-service presentations to provide education on substance use, and raise awareness on stigma to reduce the barriers to services for people who use drugs, encouraging harm reduction approach and referring to safe supply distribution sites, promoting awareness on the signs of an overdose and what to do during an overdose, and provide training and distribution of naloxone kits. We have acted in response to our community's needs by having ride-alongs with emergency medical services to provide addiction education to frontline staff and offer services to individuals who've experienced an opioid overdose or other substance-related harms. We also have new outreach case management program designed to provide individuals with brief solution-focused therapy and systems navigation. We have also engaged with new outreach action committee, which means we can connect with individuals in our community through weekly street outreach to provide education and discuss services. Your opinion matters. Here are ways we continue to improve services based on your feedback. We've worked to reduce our wait times at intake. Clients can expect their initial appointment within a week from initial contact. We've increased our ability to complete assessments and the ability to provide referrals to residential treatment agencies quickly. We've also increased our capabilities to provide outreach services and respond to crisis. And we've adapted our services to provide virtual programming. Our unique programs can help support some of the complex needs of individuals who use opiates. Let's learn more about them.
So PPW stands for Pregnant and Parenting Women. So my program is targeted for parenting women with children under 6 or who are pregnant with problematic substance use, who have either recently relapsed or is at risk of relapse. I support the mothering role. Each case is different. So I go with their goals as a harm reduction. So I work closely with the RAM clinic and also the methadone clinic. And we make the appropriate referrals and support the women where they're at. So some of the goals of the PPW program is to minimize some of the negative impacts of the substance use, to improve social outcomes of mother and children, and to provide education, support, and advocacy specifically related to the women and their families. So in response to the opiate crisis, I have scheduled more pregnant parenting applications. So now I'm doing them on a weekly basis and to try to get the clientele served properly and as fast as we could.
Hi, my name is Carol Young and I'm an addictions counselor with South Cochrane Addictions Services. I'm also an outreach case manager with the outreach team. As an outreach case manager, I provide brief solution-focused counseling to clients with complex needs. This is actually a new collaboration with the Canadian Mental Health Association in order to provide a good wraparound service for any clients who have addictions and mental health disorders and help them achieve their goals in making change and accessing the necessary service so that there's no wrong door. This is a new initiative in responding to both the opioid crisis and the homelessness within our community. We're excited about this opportunity and we hope to continue working in collaboration with other service providers in the community.
In addition to our opiate-specific programs, South Cochrane Addictions Services is the host site for the Rapid Access Addiction Medicine Clinic. We work in close partnership with the RAM Clinic's Addiction Navigator and primary care providers.
Well, RAM stands for, if you're going to break down the acronym, Rapid Access Addiction Medicine. It's a program that was started a couple years ago, which come from down south. They initially started down south to help patients that have addictions with alcohol and opioid, and to be able to rapidly assess these patients and then get them stabilized. Well, our goal is to be able to help stabilize patients that are struggling with these conditions of opioid use disorder or alcohol use disorder, because they do struggle a lot, and some of them are craving wise, and it's to get them initially either on medications or connected with our partners for either counseling, for trauma therapy, get them assessed by psychiatrists, and general just support with their condition. Well, our contribution comes from that, from patients actually accessing our services and us accessing other services like counseling and psychiatry, and us stabilizing patients with their conditions to minimize their withdrawal symptoms, to make them feel more normal so that they can be more functional in society and not use either alcohol or opioids, which in retrospect will help the financial situation, sometimes the relationships improve, and all that. So our underlying goal is to help patients get better. Our referral process, patients can self-refer, so they can show up at our clinic and self-refer, and we'll book them appointments. Or there is a referral form that has been sent out to primary care, the hospital, and our partners. So our navigator, which is the individual who works to arrange that, has been out and sent out these referral forms. So that's one way of doing it. Phone call is also an easy way to do it. Call and request to see if we can see patients is another way to do it. Or walking. Patient just walks in and they want to self-refer. They've heard about it. And that's another way that patient can access the services here. Our hours are from Monday, Wednesday, Friday. Monday, Wednesday, and Friday, mostly from 1 to 5. Friday is extended, so we do some assessments in the morning. So we've just recently added some morning times to be able to assess new patients. Our location is at 206 5th Avenue, so corner of 5th and Cedar Street. I'd like to add that we're still trying to work with community partners. A big one is with the hospital, because a lot of these patients don't either know about RAM or they present to the hospital because they're in crisis. So we're working at improving our ties with the hospital in order to facilitate them, after they're assessed and seen there, to access the services here. So it's a little bit more seamless.
If you or someone you love is being impacted negatively by substance use, we encourage you to reach out to South Cochrane Addiction Services and see what we have to offer. You're welcome to contact us between Monday to Friday, 8:30 a.m. to 4:30 p.m. at our telephone 705-264-5202.